I started self-harming around the age of 13 till 15, and then I stopped for about 2.5 years and then started self-harming again from 18 to about 24 with a few relapses afterwards.
I started self-harming when I was 13, and I stopped self-harming when I was 25, with gaps in between where I wasn't self-harming and many relapses.
I mostly self harmed between ages 12 and 20, with a handful of relapses in the last 10 years.
Perhaps as early as their seventh grade in a minor form. The first major incident, I would have been 16. That decreased a lot as I went into my 20s, and then perhaps incidentally, even up until the point that I was 27 or 28.
When I first started, it was mainly hitting and bruising, and then it eventually turned into scratching. It progressed into the cutting.
My main method of self-harming was using safety pins to superficially lacerate my skin. On occasion, I would use maybe a knife or a blade that could give a deeper cut. But other techniques that I used to self-harm were hitting myself, burning myself, anything that could really cause physical pain, or even things like over-exercising to the point where I felt weak or hurting.
Mostly cutting, although I also engaged in other risky behaviors that could be interpreted as indirect forms of self harm.
Cutting exclusively, so that would be razor blades, improvised like glass, that type of thing.
The main current one is schizoaffective disorder. Some of the past ones that I sometimes still identify with are like anxiety NOS, just mood disorder NOS, and borderline personality traits.
My primary diagnosis is bipolar type 1, and I also have a diagnosis of PTSD.
ADHD and anxiety NOS with a history of eating disorder and depression.
OCD, bipolar type 2, ADHD,